All right, everyone, get ready for a deep dive. We're going deep into the world of Medicaid and
Oh,
CHIP.
yeah, two programs that are, well, they're huge,
Absolutely massive.
but maybe, I don't know, not always fully understood by everyone.
Right, and that's what we're here for. We're using the official Medicaid website's About Us page as our guide today. So think of this deep dive as your crash course on these essential healthcare
Yeah,
programs.
essential is a great word because they impact millions of people every day.
Every single day. I have to admit, though, I get a little, lost in all the acronyms and bureaucracy sometimes.
Totally understandable. It's a big system. The About Us page kicks things off by introducing the Center for Medicaid and CHIP Services, or
Okay,
CMCS.
CMCS. I feel like I've heard that before. Is that like the control center for these programs?
It is. It's like mission control, making sure things run smoothly. And what's really interesting is how it fits into the bigger picture. So CMCS is part of the Centers for Medicare and Medicaid Services,
Yeah.
or CMS, which itself is part of the U.S. Department of Health and Human Services. It's like a whole family tree of healthcare.
Right. So CMCS is kind of like the middle child then, responsible for Medicaid and CHIP. And wait, there's another one, the Basic Health Program or BHP. What is that?
So the EJP is a bit newer. It's aimed at folks whose income, fluctuates. So they might be eligible for Medicaid or CHIP one month and then not the next. It can be a real headache bouncing back and forth between coverage.
Oh, yeah, I bet that's stressful.
Right. So the BHP is designed to provide more consistent coverage, which means more consistent care.
That makes so much sense, especially if you're managing, a chronic illness or something where you need to stay on your meds.
Exactly.
Okay, so let's zoom in on Medicaid for a sec. We hear about it all the time,
Mhm.
but I don't know. I don't think I really grasp its full impact.
Well, prepare to be amazed, because Medicaid is one of the biggest healthcare payers in the entire U.S.
Really?
It covers, get this, 1 in 4 Americans. That's over 80 million people.
Wow. No wonder it's always in the news. It really highlights how many people rely on it for their health care. But, what about families who earn too much to qualify for Medicaid? What happens to their kids?
Their kids are covered. That's where CHIP swoops in, the Children's Health Insurance Program, and make sure that kids and families who make too much for Medicaid but can't afford private insurance still get the care they need. It's like a safety net within a safety net.
Oh, okay, that makes me feel better. So we've got these three big programs, Medicaid, CHIP, and BHP, all working together to form this massive safety net. It's catching millions of people who might otherwise fall through the cracks of our healthcare system.
Exactly. And they're not just providing basic coverage either. We're talking access to doctors, hospitals, preventative screenings, so much more.
It's pretty mind-boggling when you think about the scale of these programs and the impact they have on, people's lives across the country.
It really is. And don't forget that each state actually has some flexibility in how they design and run their programs.
Oh, right. I did read about that. It's not just a one-size-fits-all system.
No, which makes sense because the needs in California are going to be different than, say, the needs in Texas, right?
Right. So it's like this dance between federal guidelines and state-level customization.
Exactly. And that's one of the things that makes this whole landscape so complex.
Absolutely. But hey, we've laid some groundwork here, and now I'm ready to dive into the details of how these programs actually work.
All right, let's do it.
Where do we even begin?
Well, a good starting point would be eligibility. Who actually qualifies for these programs?
Okay, yeah, eligibility. It can't just be about income.
It's definitely not just income, no. Well, that's a huge part of it. Medicaid and CHIP eligibility also take into account things like age, pregnancy, disability, family size.
Right, right. And we mentioned that states have that flexibility, so I'm assuming that adds another layer of complexity.
Absolutely. The criteria can vary from state to state.
Oh, I bet that gets confusing.
It can be tricky for people trying to navigate the system, for sure.
Especially if you move or, if you have a major life change or something.
Right. You can't just expect people to know all this stuff automatically.
Totally. Okay, so let's say someone figures it out and they meet the criteria. How do they actually enroll? Is it a nightmare?
Well, it definitely used to be more of a hurdle, but things are getting better.
Oh, good.
Yeah, enrollment processes are getting more streamlined thanks to technology. So generally, people can apply online or by mail or in person at a local office.
Okay, so at least they're trying to make it user-friendly.
Right, because the easier it is to enroll, the more people can access the coverage they need. And that's the goal, right? Make healthcare accessible.
Absolutely. Okay, so now someone's enrolled, they've got coverage. What kind of services can they get? What does the coverage look like?
Now we're talking benefits. And this, again, is where things can vary a bit between states.
Uh-oh.
Yeah, there are certain mandatory benefits that all state Medicaid programs have to cover. So inpatient and outpatient hospital services, doctor's visits, lab tests, prenatal care, the essential stuff, basically.
Okay, so the essential building blocks of healthcare. But what about, things like dental, vision, mental health? Are those covered too?
That's where the optional benefits come in. States can choose to cover those extra things depending on, their budget and priorities.
Oh, so some states might be super generous and some states might have like more limited options.
Exactly. And since CHP is just for kids, it tends to focus a lot on preventative care and services that, help them develop in a healthy way.
Right. Catch those potential health issues early on. Give kids the best possible start.
Exactly.
Okay, so we've covered eligibility, enrollment, and benefits. It feels like we're starting to see the big picture here of how these programs actually function. But I have a feeling there's more to explore, right? What are we missing?
Well, one big piece we haven't touched on yet is the financing. Where does the money for all this come from?
Right. Yeah, someone's got to be paying for all of this.
It's actually a partnership between the federal government and the states.
Okay, like a shared responsibility.
Right. And the federal government provides matching funds to each state based on a formula. So they take into account the state's per capita income.
So wealthier states with higher per capita incomes, they get less federal help.
Exactly. And states with lower incomes get more support. So it's meant to level the playing field and make sure that all states can provide those essential services to their low-income residents.
That's really interesting. It sounds like a system that tries to balance the needs of all the different states while making sure that everyone has like a basic level of access to healthcare.
That's the goal.
All right, so we've got this dance between federal funding and state administration, and then we have the eligibility criteria, the benefits, and enrollment all swirling around. No wonder it's such a complex system.
That's a lot of moving parts.
It is, but understanding the financing is key, right? Because that directly impacts how many resources they have and the kinds of services they can actually provide.
It all comes back to that access to care.
Everything is connected.
It is.
We've come a long way in understanding the mechanics of these programs, but I feel like there's still so much more to uncover.
There is.
So much more. Like, how about the actual administration of the programs? That's got to be a whole other beast, right?
Oh, absolutely. That's where we see how policy decisions actually translate into real-world impact.
Oh, okay. That sounds intriguing. I'm ready to dive in.
Yeah.
So what exactly does program administration entail? What kind of decisions are we talking about here?
Well, states actually have a lot of leeway in how they run their Medicaid and CHIP programs. Like, for example, they get to decide how they want to actually deliver those services.
Oh, okay. So how the services are delivered. Interesting.
Yeah. And there are a lot of options. They could go with a fee-for-service model.
Fee-for-service.
Yeah, where providers are paid for each individual service they provide. Or they could opt for managed care organizations.
Oh, okay. So that's where managed care comes in. I've heard that term, but I've never really understood what it means.
Well, with managed care, the state contracts with health plans to manage care for the beneficiaries. So it's kind of like having an insurance company managing your Medicaid benefits.
Okay, yeah, I can see that. So that's a big part of Medicaid and CHIP these days, this managed care.
It is.
Okay. And you said states can also set their own provider payment rates.
They do, and that's a big deal.
So you mean how much doctors and hospitals get paid for treating Medicaid patients?
Exactly. And those rates, well, they can really affect whether providers want to, accept Medicaid patients or not, especially in areas where it's already hard to find a doctor, like in rural areas or underserved communities.
Oh, right. Because if the payment rates are too low, then doctors just won't accept Medicaid patients.
Right, and that obviously limits people's access to care.
Totally. So it's all about, like, incentives, right?
Yeah.
If you want good care everywhere, you got to make sure that providers are being paid fairly.
You got it.
Wow. Okay, so we have the delivery models, the payment rates. What else? What other decisions do states have to make?
Well, there's program integrity.
Program integrity.
Yeah, it's all about making sure that the claims are accurate, that there's no fraud, and that we're protecting, taxpayer dollars.
Oh, yeah, that
No one wants to see those resources wasted.
No, absolutely not. But how do they even keep track of all of that? It seems like a logistical nightmare.
It's a lot of work. States have to put systems in place to monitor those claims,
Mm.
investigate anything that looks suspicious, and, hold providers accountable.
So it's like a constant balancing act.
It is.
States have to juggle all these different decisions, from the delivery models to payment rates to this program integrity, and they're trying to provide the best possible care within, a limited budget.
It's not easy.
No, not at all. And it's not like it stays the same, right? It's constantly changing as healthcare policy changes and technology advances.
It's constantly evolving.
Wow, that's both challenging and exciting.
It is. It's a field that demands constant learning and adaptation.
Right, and that's why these conversations are so important.
They are.
We need to stay informed and engaged if we want these programs to be successful.
Absolutely.
So far, we've covered a lot of the mechanics of how these programs work.
We have.
But there are these other layers we need to explore.
Right, like the Affordable Care Act and its impact on Medicaid.
Oh, yeah, the ACA. I almost forgot about that. Didn't that law significantly expand Medicaid eligibility in a lot of states?
It did. That expansion was a major turning point for Medicaid. It brought millions more people into the program, but it also created a whole new set of challenges and debates that are still going on today.
Oh, wow. Okay. It sounds like the ACA really shook things up in the world of Medicaid.
It did. And its legacy is still being felt today, shaping the future of these programs in a lot of ways.
So we're definitely going to need to unpack that whole ACA expansion.
We are.
What exactly changed? What were some of the consequences?
Well, the goal of the expansion was to cover more low-income adults who didn't qualify before. You see, before the ACA, Medicaid for adults was very limited, especially if you didn't have kids.
Right. It was mostly for pregnant women, children, the elderly, and people with disabilities.
Right. So the ACA wanted to change that by expanding eligibility to pretty much any adult who made less than 138% of the federal poverty level.
Wow. Okay, so that's millions of people suddenly eligible for coverage.
It is. But here's the interesting part. The Supreme Court ruled that states could actually choose to opt out of the expansion.
Really?
Yeah, and a bunch of states, mostly those with more conservative legislatures, decided not to expand.
Wow, so it became a political issue.
It did. It was a mix of things. Some states were worried about the long-term costs, even though the federal government was covering most of it at first. Others just didn't like the ACA and saw the expansion as overreaching.
So different states, different approaches based on their own priorities and political leanings.
Exactly. And that's created this patchwork system across the country where what you're eligible for and what you're covered for can be completely different depending on where you live.
That's crazy. It's wild how much politics can influence healthcare.
It really can.
But what about the states that did expand? Did they see positive results?
Oh, yeah, for sure. Studies have shown that in states that expanded, more people got access to care, their health actually improved, and there was less financial strain on low-income families.
Oh. That's good news. So it sounds like the expansion worked in a lot of ways, but it also created this, this political divide.
And this uneven landscape of coverage across the country.
Yeah.
It's a mixed bag for sure. And it brings up all these questions about the future of Medicaid and CHIP. How do these programs adapt to the ever-changing healthcare landscape? How do we address the differences in coverage between states? How do we make sure these programs will last in a time when, everything feels so politically charged and money is tight?
Yeah, those are really big questions.
They are.
And they remind us that we're talking about the health of millions of people here.
Real people.
Right, real people. It's not just numbers on a spreadsheet.
It's important to keep that human element in mind.
Absolutely. Okay, well, we've explored the purpose of Medicaid and CHIP, and we've gotten into the nitty-gritty of how they operate, at least at a basic level.
We've made a good start.
We have. But now I want to talk about something that you mentioned earlier. Technology. Because I have a feeling that technology has a bigger impact on these programs than I realize.
Oh, technology is transforming how these programs work, from enrollment to care coordination to even program integrity efforts.
Okay, you've officially piqued my interest. What kind of technological advances are we talking about here?
Well, for starters, a lot of states are using technology to streamline the application and enrollment process. So they're setting up these online portals where people can apply for benefits, check their status, and manage their coverage all in one place.
Oh, that's so much easier than, filling out tons of paperwork or waiting in line at some government office.
Exactly. And it's not just about convenience. It's about making things accessible. Online portals are particularly helpful for people in rural areas or people with disabilities who might have a harder time accessing those traditional methods.
Right. So it's making the programs more inclusive.
It is. And technology is also playing a big role in improving care coordination for people enrolled in these programs.
How so?
Well, think about electronic health records.
Oh, yeah, those are everywhere these days.
Right, they're becoming the norm, and they make it so much easier for providers to share information and coordinate care, even if the patient is seeing multiple doctors.
Okay, so how does that work in practice?
Imagine a patient who sees their primary care doctor, then a specialist, and maybe even a therapist. With electronic health records, all those providers can see the patient's medical history, their medications, their test results, no matter where the patient is seen.
Oh, wow, so it's like instant access to all that information.
Pretty much. No
Yeah.
more faxing records or playing phone tag.
So much more efficient.
Exactly. And it makes sure everyone involved in the patient's care is on the same page.
So it's not just about convenience for the patient, it's about making sure the care is actually better.
It is. And that's not all. Technology is also being used to boost program integrity by, identifying and preventing fraud.
Oh, right, you mentioned that earlier. So how does technology fight fraud?
Well, they use these sophisticated data tools to analyze claims and look for patterns that might suggest something fishy is going on.
Okay.
Like if a provider is billing for way too many services or procedures that don't make sense for the patient, it can raise red flags.
So it's like a digital detective.
Exactly. And that can save a ton of money by catching fraud early on.
Yeah, that makes sense.
And those savings can then be used to provide more care to people who need it.
Right. So it's a win-win.
It has the potential to be.
Absolutely. Okay, so technology is really transforming these programs from like every angle.
It really is.
Streamlining enrollment, improving care, making things more secure. It sounds like the future is here.
Well, the future is definitely being shaped by technology.
Right. Okay, so we've covered the impact of the ACA and the role of technology. I feel like we're really getting a handle on these programs.
Oh, big in progress.
But there's always more to learn, right? What else should we be thinking about?
Well, we haven't talked about the impact of social determinants of health.
Social determinants of health. I'm not familiar with that term.
It refers to all those non-medical things that can affect a person's health.
Sure.
So like their living conditions, access to food, transportation, their social support networks, things like that.
Oh, okay. So it's recognizing that health isn't just about, going to the doctor. It's about your whole life.
Exactly. And studies show that those social determinants play a huge role in health outcomes, especially for folks with low incomes.
Right, because if you're struggling to put food on the table or you live in a dangerous neighborhood, it's going to be hard to stay healthy no matter how much healthcare you have access to.
Exactly. And that's why a lot of states are starting to think about social determinants of health as part of their Medicaid and CHIP programs.
Really? How so?
Well, some states are using Medicaid funds to help homeless people find housing. Others are funding transportation programs so people can get to their appointments and, buy groceries. Some states are even testing out food benefits programs and job training to address poverty.
Wow, so it's like these programs are evolving to address the whole person.
It's a much more holistic approach, recognizing that improving someone's health means improving their life.
That's a powerful idea. But I imagine there are challenges too, right? Like, how do you measure the impact of all of this and how do you get everyone on board, all these different agencies and organizations?
It's not easy, that's for sure.
No.
It takes a lot of collaboration, creativity, and a willingness to try new things.
Yeah. But the potential benefits they're huge.
Huge.
Okay.
By addressing social determinants of health, we can improve people's lives, reduce health disparities, and create a healthcare system that's more just and fair for everyone.
That's an inspiring vision.
It is.
And it makes me even more curious about the future of these programs. What other changes or innovations are coming down the pipe? What are the big questions that policymakers are wrestling with?
One of the biggest issues is long-term sustainability. As the population gets older and healthcare costs keep going up, states are feeling the pressure to keep spending under control without sacrificing the quality of care.
Right. That makes sense. Healthcare costs they're a huge issue right now.
Absolutely. And there are all sorts of ideas floating around about how to solve this problem. Some policymakers want to change how Medicaid is funded.
Okay.
Others want to encourage those more efficient care models we talked about earlier.
So much to figure out.
It's a dynamic landscape, always changing, always new challenges and opportunities.
This deep dive has been incredible.
It has been.
I feel like I have a much deeper understanding of these programs now.
Good. It's an important topic and often overlooked.
Yeah, it is.
These programs are essential for so many people.
Okay, so we've talked about the ACA, technology, social determinants of health, and the whole issue of sustainability. Is there anything else we need to cover? Anything we've missed?
Well, we haven't talked about the pandemic yet.
Oh, right. COVID. I can't believe we almost forgot about that.
It feels like a lifetime ago, but it obviously had a huge impact on healthcare and especially on programs like Medicaid and CHIP.
It was a pretty wild time for everyone. So, what were some of the key ways in which COVID affected these programs?
One of the most immediate things was a huge surge in enrollment.
Oh, yeah, I remember hearing about that.
People were losing their jobs, losing their health insurance, so they turned to Medicaid.
So, it's a safety net during a global crisis.
It was. And it showed just how important it is to have these safety net programs in place because you never know when you're going to need them.
Right, so enrollment went way up, which must put a strain on state budgets.
It did. And the pandemic also changed how care was delivered. Think about telehealth.
Oh, yeah, telehealth. Everyone was suddenly seeing their doctor from their living room.
It was a huge shift, and Medicaid and CHIP were actually really important in making that happen. They changed some of the rules around telehealth and increased how much they would reimburse for those virtual visits.
Wow, so they were really at the forefront of that transition to telehealth.
They were. And the pandemic taught us a lot about how important flexibility and innovation are in these programs.
Yeah, because things can change so quickly.
They can. And we need programs that can adapt and embrace new technologies and new ways of providing care.
Right. So we learned about flexibility, about innovation, and we also saw, how important those social determinants of health are.
Exactly. Because the pandemic hit vulnerable populations the hardest. People who are already struggling with poverty, food insecurity, unstable housing.
So it was a wake-up call.
It was.
We can't just focus on healthcare. We have to focus on those broader social factors as well.
It's all connected.
All right, so we've explored the ACA, technology, social determinants of health, the challenges of sustainability, and now the impact of the pandemic. I feel like we've covered so much ground.
We've made great progress.
But I have a feeling there's still more to learn.
There always is. Look, we haven't even touched on the issue of health equity and how Medicaid and CHIP can be used to address those disparities in access to care and outcomes.
Health equity, that's a huge topic.
It is.
And it's something that we're all talking about more and more these days. We're finally starting to acknowledge those systemic barriers and biases in healthcare.
About time.
Right. And it seems like Medicaid and CHIP have a really important role to play here, right? Because these programs serve so many people of color, low-income folks, people in rural areas. These are the folks who often have the hardest time getting quality care.
You're exactly right. So it's not just about providing health care. It's about social justice.
It's about creating a more equitable society for everyone.
Exactly. And that's a perspective that's becoming more common among policymakers.
That's encouraging.
It is.
Okay, so I'm ready to learn more about this. How are these programs actually being used to advance health equity? What kinds of things are being done to address these disparities?
Well, there are a lot of different approaches being taken at both the federal and state levels. So, for example, CMS, the Centers for Medicare and Medicaid Services, they've launched a few initiatives aimed at promoting health equity, like the CMS Equity Plan for Improving Quality in Medicare and the Advancing Health Equity Strategy.
Okay, so the federal government is taking it seriously.
They are. And these initiatives are all about addressing disparities for those underserved populations, including people on Medicaid and CHIP.
That's great. And what about states? Are they doing anything specific to promote equity within their own programs?
Oh, absolutely. A lot of states are trying really innovative things. Some states are focused on expanding access to culturally competent care.
Okay, so making sure that people can access care that's sensitive to their cultural background.
Exactly.
That's so important.
It is. So they're supporting providers who serve diverse communities, and they're offering things like language assistance services.
Right, because if you don't understand what the doctor is saying, you're not going to get very good care.
You got it. And other states are focusing on those social determinants of health we were talking about.
Oh, right.
So they're including screenings for food insecurity, housing issues, and other social needs right into their Medicaid and CHIP programs.
Wow, so much is happening.
It's a constantly evolving landscape with new ideas and initiatives popping up all the time.
And it sounds like health equity is a top priority.
It is.
Well, this deep dive has been an incredible journey.
It has been.
We've explored the history and the evolution of Medicaid and CHIP.
All the moving parts.
We've seen how they work. We've looked at the challenges, the successes, and even got a glimpse into the future.
It's been quite a ride.
It has. But before we wrap up, there's one more question that I just have to ask.
Oh, what's that?
Well, we've talked about all the complexities of these programs, the political debates, the budgetary issues, the logistics, even some ethical considerations.
Yeah, it's complicated.
It's a lot. But amidst all of that, I'm curious about the success stories. What are some of the inspiring things that have come out of these programs? What gives us hope?
That's a wonderful question. It's so easy to get caught up in all the policy stuff, but at the end of the day, it's about people. It's
Exactly.
real people whose lives are being changed.
So tell me about some of those changes. How have Medicaid and CHIP made a real difference in people's lives?
Well, one of the most powerful examples is the impact on maternal and child health. Medicaid is actually the biggest payer of maternity care in the entire U.S. It covers nearly half of all births.
Wow, had no idea.
And studies have shown that Medicaid expansion has led to big improvements in maternal health outcomes.
Really? Like what?
Well, things like lower rates of maternal mortality
That's amazing.
and fewer preterm births. For a lot of low-income women, Medicaid means that they can have a healthy pregnancy and a safe delivery.
It's so easy to take that kind of care for granted.
It is. And it's not just about the mothers. Medicaid also provides health care for millions of children. Well, child visits, immunizations, all those important services that help them grow up healthy.
So it's giving kids a healthier start to life.
Exactly. And that's just one example. Medicaid and CHIP have also helped expand access to mental health treatment and substance abuse treatment,
Okay.
improved care for people with disabilities, and they've provided support for older adults and those with chronic illnesses.
It's incredible when you think about the ripple effects these programs
They
have.
touch so many lives.
And while there are challenges, it's important to remember those successes, right?
Absolutely. It's easy to get lost in the weeds, but we have to celebrate the good stuff and recognize how much of a difference these programs are making.
They really are making a difference.
They are.
All right. Well, I think that's a perfect place to pause for now.
It is.
We've covered so much ground,
We have.
but I have a feeling our deep dive isn't over yet.
Oh, we're just getting started.
All right, everyone. We'll be back soon to continue our exploration of these essential programs. Stay tuned.
See you next time.
So, states have all this power to decide how they run things. It's like a lot of choices. What kind of stuff are we talking about?
Oh, it's a lot. Like we were saying, they decide how to deliver services. Could be fee for service,
Right, fee for service.
where each service the provider gives, they get paid for. Or they could choose managed care organizations.
Managed care, it's like everywhere, but I don't really get it. It's like an insurance company, but for Medicaid.
Yeah, that's a good way to think about it.
Yeah,
It's a big part of Medicaid and CHIP now.
yeah,
Trying to coordinate care and keep costs down,
yeah.
And states also set how much providers get paid.
Wait, really? They decide how much doctors and hospitals get paid for treating people on Medicaid.
Yep, and that's huge
Yeah.
because those rates can determine if providers will even take Medicaid patients. Especially think about rural areas, places where it's already tough to find a doctor.
Yeah, if you're not getting paid enough, why would you take those patients?
Right, and that makes it harder for people to get the care they need.
Makes total sense. So it's about like making sure the system works for everyone, right?
Exactly. And then you've got program integrity.
Program integrity.
Yeah, making sure the claims are right, no fraud, protecting taxpayer money, all that.
That's super important. No one wants to see those resources wasted. But how do they even keep track of all that? It seems impossible.
It takes serious effort. States have to put systems in place, monitor those claims, investigate anything suspicious, hold providers accountable. It's about being responsible with public money, making sure these programs can last.
So states have to juggle a lot. Delivery models, payment rates, this whole program integrity thing, all while trying to provide the best care possible with like a limited budget.
It's a constant balancing act for sure.
And it's not static, right? Healthcare is always changing, new technologies, new policies.
It's evolving all the time.
Makes it a challenge, but also exciting. Got to keep up with the times.
Exactly. And that's why we have to stay informed about these programs, talk about them, think about their future.
And with you there, we've learned so much in this deep dive, from the big purpose of Medicaid and CHIP to like how they actually work on the ground, state by state. But there's still more to uncover, right?
Oh yeah, tons.
Hmm.
Like we haven't even touched on the Affordable Care Act.
The ACA, I knew we'd get to that. Didn't that law like massively expand Medicaid eligibility?
Big time. It was a turning point. Millions more people got covered. But it also created new challenges and debates that are still going on.
Oh, wow. So it really changed the game for Medicaid.
Completely. And its impact is still being felt today, influencing everything about these programs.
Oh, we got to dig into this. What exactly changed? What were some of the, the unintended consequences, maybe?
Well, the main goal was to cover low-income adults who were falling through the cracks before. You see, pre-ACA, Medicaid for adults was pretty limited.
Yeah.
Especially if you didn't have kids.
Right. It was mainly for Pregnant women, kids, elderly folks, people with disabilities.
Exactly. So the ACA came along and said, hey, let's expand eligibility to almost any adult making less than 138% of the poverty level.
So suddenly, millions more adults could get coverage.
Yep. But here's where it gets interesting. The Supreme Court decided that states could actually opt out of this expansion.
No way. Really?
Yeah, and a bunch of states, mostly those with more conservative legislatures, they chose not to expand.
So it became this whole political battleground.
Total political football. It was a mix of reasons. Some worried about long-term costs, even with federal help. Others, well, they just didn't like the ACA and saw it as, I don't know, government overreach.
Wow. So depending on where you lived, your access to healthcare could be totally different.
Right. This patchwork system across the country. Confusing for everyone, especially people trying to navigate the system.
What a mess. But what about those states that did expand? Did they see any good come out of it?
Oh, yeah, big time. Studies show that in those states, more people got access to care, their health improved, and there was less financial stress for families.
Okay, so it seems like the expansion was a success in a lot of ways, but it definitely created this divide, this uneven playing field across the country.
Yeah, that's the legacy of the ACA.
Yeah.
Lots of good, but with some complications too.
Yeah.
And it brings up all these questions about the future of these programs. How do we make sure they stay strong in a time of so much political division and money problems?
Those are big, big questions, and I guess the answers will determine the health and well-being of millions of people, right?
Right. It's not just about numbers. It's about real people's lives.
Exactly. Okay, well, we've gone deep into the purpose and the inner workings of Medicaid and CHIP. We've talked about the Affordable Care Act and all its complexities.
With some moving parts.
So many moving parts. But I think it's time we talked about something you mentioned earlier, technology. Because I have a feeling it plays a bigger role than most people realize.
Oh, technology is absolutely changing the game for Medicaid and CHIP. Streamlining enrollment, improving care coordination, even strengthening program integrity. It's pretty amazing what's happening.
Okay, now you've got me really interested. What kind of technological advancements are we talking about?
Well, for starters, a lot of states are using technology to make applying and enrolling much easier. Think online portals where people can apply for benefits, check their eligibility, manage their coverage, all in one place.
Oh, that's so much better than dealing with paperwork and waiting in line at some government office.
Exactly. It's more convenient and more accessible, especially for people in rural areas or those with disabilities.
Right. Technology can break down those barriers.
They can. And it's not just about enrollment. Technology is also playing a big role in improving care coordination for people enrolled in Medicaid and CHIP.
Okay, how so?
Think about electronic health records. They're becoming the norm, and they allow providers to share patient information and coordinate care so much more easily, even if the patient sees multiple doctors.
Electronic health records. I've heard of those, but how are they actually being used to improve care coordination?
Imagine a patient sees their primary care doctor, then a specialist, then maybe a therapist. With electronic health records, all those providers can see the patient's medical history, medications, test results, everything, no matter where they were seen.
Wow, so there's no more faxing records back and forth or trying to track down information from different providers.
Exactly. It streamlines communication and makes sure everyone involved in the person's care is on the same page.
So it's better for the patient and better for the providers.
Absolutely. And then there's the role of technology in enhancing program integrity. Remember we talked about that?
Yes, making sure there's no fraud and that taxpayer money is being used responsibly. But I didn't realize technology played a role in that.
Oh, it's a big part of it. Sophisticated data analysis tools are being used to look for patterns in claims data that might indicate fraudulent activity.
So, like, if a provider is billing for way more services than usual or billing for things that don't make sense, that would get flagged.
Exactly. It's like having a digital detective on the case. And it saves a lot of money, which can then be used to provide more care to people who need it.
It's amazing how technology is transforming these programs, making them more efficient, more effective, and more secure.
It's pretty incredible.
So we've covered the Affordable Care Act, the role of technology. I feel like we're really starting to get a grasp on these programs, but I know there's always more to learn.
You're right. There's one more important concept we need to discuss. Social determinants of health.
Social determinants of health. I'm not familiar with that term. What does it mean?
It's all about recognizing that health isn't just about what happens in a doctor's office. It's about all those factors in a person's life that can impact their health. Things like where they live, whether they have enough food, access to transportation, social support, things like that.
Okay, so it's a much broader view of health. It's acknowledging that people's circumstances and environment play a huge role in their well-being.
Exactly. And research shows that those social determinants are especially important for people with low incomes.
Right, because if you're worried about where your next meal is coming from, or if you live in a neighborhood with high crime rates, it's going to be hard to stay healthy, even with good health care.
Exactly. And that's why more and more states are starting to consider social determinants of health as part of their Medicaid and CHIP programs.
Really? That's fascinating. How are they doing that?
Well, there are a lot of different approaches. Some states are using Medicaid funds to help people find housing. Others are supporting transportation programs to make sure people can get to doctor's appointments and grocery stores. Some are even experimenting with food benefits and job training programs to address poverty.
Wow, so these programs are evolving to address the whole person, not just their medical needs, but the social and economic factors that impact their health as well.
It's about recognizing that health is multifaceted, and we need a more holistic approach.
But I imagine that's not easy, right? Trying to address these complex social issues, coordinating services across different agencies.
It's definitely challenging. It requires collaboration, creativity, and a willingness to try new things. But the potential payoff is huge.
Right. If we can address these root causes, we can make a real difference in people's lives.
Absolutely. We can improve health outcomes, reduce disparities, and create a more just and equitable healthcare system for everyone.
It's a powerful vision. And it makes me wonder, what does the future hold for Medicaid and CHIP? What are some of the big questions that we need to be thinking about as we move forward?
Well, one of the biggest challenges facing these programs is the issue of long-term sustainability.
Oh, right. We talked about that earlier. With healthcare costs rising all the time, it's a big concern.
It is. States are facing increasing pressure to control spending, but they also need to make sure that people are getting the care they need.
So it's a balancing act.
Exactly. And there are a lot of different ideas out there about how to address this. Some people think we need to change the way Medicaid is financed. Others want to focus on making healthcare delivery more efficient.
So it's a dynamic and constantly evolving landscape.
It is, and that's what makes it so interesting to follow.
Okay, so we've talked about the Affordable Care Act, the role of technology, the importance of addressing social determinants of health, and the challenges of sustainability. It feels like we've covered so much ground, but I have a feeling there's always more to uncover.
You're absolutely right. We haven't even touched on the impact of the COVID-19 pandemic on Medicaid and CHIP.
Oh, the pandemic! I can't believe we almost forgot about that. It seems like a lifetime ago, but it obviously had a huge impact on everything.
It was a defining moment, for sure, and it really highlighted both the strengths and weaknesses of these programs.
Okay, I'm definitely sensing another deep dive coming on, but before we go there, let's unpack the pandemic's impact a little bit. What were some of the key ways COVID-19 affected Medicaid and CHA?
Well, one of the most immediate impacts was a surge in enrollment. As people lost their jobs and their health insurance, Medicaid became a lifeline.
Right, it was a safety net for millions of people during a time of crisis.
Exactly.
Yeah.
And it really showed how important it is to have these safety net programs in place.
So enrollment went way up, which must have put a lot of pressure on state budgets.
It did. But the pandemic also changed how care was delivered. Think about all the telehealth that happened.
Oh, yeah, telehealth. I remember those ads. Everyone was suddenly seeing their doctor from their living room.
It was a huge shift.
Yeah.
And Medicaid and CHI played a big role in making that happen. They relaxed some of the rules and increased reimbursement rates for virtual visits.
So they were really on the front lines of adapting to this new reality.
They were. And the pandemic taught us a lot about the importance of flexibility and innovation in these programs. We need to be able to adapt quickly to changing circumstances.
It was a crash course in adaptability for everyone.
Exactly. And it also underscored the importance of addressing social determinants of health. We saw how factors like poverty and housing instability made the pandemic even worse for some communities.
Right. It was a stark reminder that health is connected to all these other factors.
It is. And these are lessons that will continue to shape the future of Medicaid and CHIP.
Okay, so we've talked about the Affordable Care Act, the role of technology, the importance of social determinants, sustainability, and the impact of the pandemic. That's a lot, but I feel like there's still more to this story.
You're right. We haven't even touched on the issue of health equity and how Medicaid and CHIP can help address those disparities we see in healthcare.
Health equity, that's such a critical issue, especially now as we're becoming more aware of the systemic barriers that exist in healthcare.
It's essential that we address those barriers and create a more just and equitable system, and Medicaid and CHIP have a big role to play in that.
Okay, I'm ready to dive into this. How are these programs being used to promote health equity? What are some of the strategies being implemented?
Well, there are a lot of different approaches being taken at both the federal and state levels. For example, CMS has launched several initiatives aimed at reducing disparities in care and outcomes for underserved populations.
So there's recognition at the federal level that this is a priority.
Absolutely. And at the state level, we're seeing a lot of innovation and creativity. Some states are focusing on expanding access to culturally competent care. They're supporting providers who serve diverse communities and offering language assistance services.
That makes so much sense. If you can't communicate with your doctor or understand the healthcare system, you're not going to get good care.
Exactly. And other states are working to address social determinants of health by incorporating screenings for things like food insecurity and housing instability into their Medicaid and CHIP programs.
Wow, so many different approaches, all aimed at making these programs more equitable.
It's an exciting time to be working in this field. There's a lot of energy and momentum around health equity, and Medicaid and CHIP are at the forefront of this movement.
This deep dive has been incredible. I feel like I've gained a whole new understanding of Medicaid and CHIP, their history, their complexity, the challenges, the
A
successes.
lot to take in.
It is. But before we wrap things up, I have one more question. Throughout this conversation, we've talked a lot about the complexities and the challenges of these programs, the political debates, the budget constraints. But I'm also curious about the successes, the stories that remind us why this work is so important.
That's a great question. It's easy to get bogged down in the details and forget about the human element. But at the heart of these programs are real people whose lives are being transformed every day.
Exactly. I want to hear about those transformations. What are some of the most inspiring success stories that have emerged from Medicaid and CHIP?
Well, one of the most powerful examples is the impact on maternal and child health. Medicaid is the largest single payer of maternity care in the United States. It covers almost half of all births. And studies have shown that Medicaid expansion has significantly improved maternal health outcomes. Fewer mothers are dying during childbirth, and fewer babies are born prematurely.
That's incredible. Medicaid is literally saving lives.
It is. And it's not just about mothers. Medicaid ensures that millions of children have access to the care they need to grow and thrive. Well, child visits, immunizations, all those essential services.
It's giving children a healthier start to life.
Exactly. And these programs are doing so much more. They're expanding access to mental health and substance abuse treatment, improving care for people with disabilities, supporting older adults, and people with chronic illnesses.
Wow, the ripple effects of these programs are just incredible.
They touch so many lives in so many positive ways.
It's easy to get lost in the political debates and the budget numbers, but ultimately these programs are about people, about providing care, improving health, and creating a more just and equitable society.
Beautifully said.
Well, I think that's a perfect note to end on. This has been an incredible deep dive, and I'm so grateful for your insights.
It's been my pleasure.
And to our listeners, thank you for joining us on this journey. We hope you've gained a deeper understanding of Medicaid and CHIP and the crucial role they play in our healthcare system.
And as you continue to learn about these programs, remember the human element, the individuals and families whose lives are touched by Medicaid and CHIP every day.
That's a powerful message to carry with us. We'll see you next time for another deep dive. So, health equity, it's a big deal, but how are Medicaid and CHIP actually being used to, make things fairer and address those healthcare gaps?
It's a multi-pronged approach for sure. CMS, the Centers for Medicare and Medicaid Services, they're leading the charge with initiatives like the CMS Equity Plan for improving quality in Medicare and the Advancing Health Equity Strategy.
Okay, CMS, those sound familiar.
They're focused on tackling disparities in care quality, access, and outcomes for those often left behind, including folks enrolled in Medicaid and CHIP.
So the feds set the stage, but it's the states who run the show, right? What are they doing to address these issues within their own programs?
States are getting creative. Some are focusing on culturally competent care, making sure providers understand and respect the needs of diverse communities. Offering language assistance is a big part of that.
Right, because if you don't understand the doctor or the system, how can you get the care you need?
Exactly. And many states are also tackling those social determinants of health we talked about. They're incorporating screenings for food insecurity, housing instability, and other social needs right into their Medicaid and CHIP programs.
So it's not just about treating illnesses, it's about recognizing how those social factors impact health in the first place. It's a much more holistic approach.
Exactly. It's about understanding that health is connected to every aspect of a person's life.
This has been an incredible deep dive, honestly.
It
We've covered so much: the history, the mechanics, the challenges, the successes, the future of these programs. But before we wrap up, what's the one thing you really want our listeners to take away from this?
Remember the people. Behind all the acronyms, the regulations, the budgets, there are real people whose lives are deeply affected by these programs. A pregnant woman getting prenatal care, a child getting vaccinated, an older adult accessing long-term care. Medicaid and CHIP are making a difference for millions of Americans every single day.
It's a powerful reminder that these programs aren't just about numbers. They're about people, about caring for one another, and building a more just and equitable society.
Couldn't have said it better myself.
Well, everyone, that wraps up our deep dive into Medicaid and CHIP. We hope you learned something new today and maybe even feel inspired to learn more.
Thanks for listening.
And remember, stay curious, stay informed, and keep asking those tough questions. Until next time, this has been The Deep Dive.